Welcome everyone to this evening's volunteer event all about diabetes health checks. And I'm really pleased that I'm going to be kicking off the session with our Assistant Director of Services, Helen, who's going to be talking to you about Best Care Ambition, but more specifically the work we're doing at the moment around raising awareness of health checks and how you can get involved. So I shall hand over to you, Helen.
Thank you very much, Danny, and it's lovely to be here this evening with you and to talk to you about this topic, which is one of my favourites at the moment. So it's a really important issue for Diabetes UK, and it's just delightful to see so many of you wanting to come and have a chat about it. Excellent. So hopefully you can see all of those slides. So we have a number of ambitions as a charity. We focus on a few things to help us concentrate and motivate ourselves around some very focused pieces of work and see some real changes in those particular pieces. The one that we're going to talk about today is the essential care processes. Now, we use about 100 different names for them, so let's kind of get that out of our systems right now. The NHS calls them care processes. Sometimes we call them essential care processes. Some people call them annual checks. They're all essentially the same thing, and we'll get into a little bit of the detail of what they are as we go through the conversation. But they are essentially a basic, fundamental part of diabetes care for all people with diabetes. In England, we have our kind of best numbers around who's actually getting these checks. I apologise to colleagues from Scotland, Northern Ireland and Wales. The data is always slightly trickier to get in your countries. Wales, I've forgotten the reason for. The others I'm a bit more confident on. So I'll keep chasing that, because actually just knowing what's going on in the NHS and having visible data is a real key part of this for us. So we reckon there's probably like a bit under about 2/3 of people getting all of their checks every year. But that means, more than 1/3 are not. And we know that that's not necessarily needs to be the case everywhere. We know that some areas are doing very, very well or much better and up around 7%.
Right, just going in the background.
Yeah, sorry.
And so if everybody in England at least was up to that kind of level, we would be talking 650,000 more people with diabetes getting a check. And sometimes it's helpful to think of the number. When we're in this world, we often talk about percentages and they don't mean as much. That's a huge number of people not getting the care they need right now. And as I said, that's just in England. It doesn't include the people in similar situations in Scotland, Wales and Northern Ireland. Right, next slide, please. Emily? I'll keep talking. So as I said, why would we focus on these in particular? They're the building blocks to good care. They're really evidence-based. So each one of these checks helps identify something early that might go wrong. That means that the healthcare system can treat and reduce the risk of complications and support you to stay well for longer. We know there's lower average uptake in care processes, both of people who are younger, so people who are under 40, and in areas of deprivation. And as I said before, there's huge variations in different places. So different GP practices from 2 streets away might do very different things. And within your own local area, I live in South East London, it might vary quite a lot across South East London. And we know that means it's not for sensible or reasonable reasons. It's because people are just doing stuff differently. And it means we could make a change. And one thing we always try to emphasize is people might already have some complications, things do develop, but it's still really important for people with complications to also have their checks to make sure they're getting the ongoing support that they need. So it shouldn't just be seen as something for one group of people and not for others. Now, this is the tricky bit. There are 9 of them, and it's difficult to remember 9 things. Like telephone numbers, six numbers. 9 isn't a number that's easy to remember. So I'm going to see, just as I keep talking now, if any of you can remember them. You can pop them in the chat, as many as you can remember. This is where I have to do a deep breath, isn't it, Emily?
Remember what?
The care process, the annual checks that you should have every year from the NHS. I'm going to reveal them next, so don't feel pressure if you're not sure of which ones they are. Emily's put that in chat. Right, Emily, next slide. Let's see if we can do them. And I have Esther on hand, who is one of our clinical advisors if I get stuck. Okay, do the next one, Emily. Great. This we developed a little bit to try and make it a bit simpler, and you'll see that there are actually only 7 blocks there because we tried to merge a few of them because it kind of gets, oh, Emily, lost the slides there. Can you still see the slides? Oh,
I still
Yeah.
can see them, yeah. It's
I-
currently the what checks should people get annually one.
yeah, I can't see that. I don't know what I've done there. Bear with me a second. This is a good time for you guys to be reading them. I don't know what I've done with my view. Ah, there we go. Zoom, please don't put new things in just to confuse people like me. So you'll get a blood test and it will do 3 things, which is why we get to do the less things. So check your blood sugars, your cholesterol, and there's a check around your kidneys. There's a check of eyes. I'm not sure that's every year, but there's a check of eyes. There's a check of your feet. There's a different check for kidney damage, which checks through your urine. Check your blood pressure, weight and height, and asked if you're smoking. These aren't most of these aren't very radical checks, but they're really important to help us see if things are coming up that might prove problems in the later. And I really like this graphic because I often forget. As I said, 9 things are really difficult to remember. So we're trying to make it as easy as we can for people to understand this and put things really simply. Next slide, please, Emily. So we've talked to lots of people with diabetes, and I'll be interested to hear your stories and if your reflections are similar to this around what happens in relation to these annual checks and how people feel about them, what they say. Some people just don't want to waste NHS time. We hear in the news, don't we, all the time how busy the NHS is, and that plays into people's perceptions. Some of us are also cynical that it's a bit of a tick box exercise, either to save money or just something that the NHS feels it needs to do. Some people don't understand about why the checks are needed, and if that's true, they're much less likely to attend. And I think something that comes up as we go through this list is feeling like nothing will change because of the check. So what's the point? You have the check and then you hear nothing more about it. There are some people, and particularly this was probably true during COVID periods, that people got really used to not coming. They know their own illness. They're, confident in self-care and are feeling like they have things under control. And if that's the case and they haven't had a lot of feedback, it can be difficult to think, yeah, this is something that I definitely need to do. I think there's also something around a fear and anxiety around the worst case scenario. So if I don't go for the check, they won't be able to tell me any bad news. We definitely know, and I'm sure many of you who've been to conversations about this, the fear of stigma, those attitudes and comments that you get from healthcare professionals being told off for, a real focus on the numbers rather than how you feel and how the condition is affecting you can really put people off coming. Plus there's life, isn't it? It's harder to keep up with appointments when you're busy, new job, new baby, exams, caring responsibilities, lots of stuff to do. The NHS isn't always open at hugely accessible hours, and sometimes you need to go more than once or twice in order to get all the checks done. So you might get some of them done because they managed to catch you, but there's another one we've missed, and it's hard to pick up that last 1 or 2. And then there's something about work, like trying to get time off work. We're all here in the evening, but trying to get an appointment for the NHS during non-working hours, and not being able to talk about it at work because that context of not having that conversation at work. So those are some of the things that we heard about what people with diabetes say about these checks and why they might not come. Next one, Emily. And the really positive thing that I wanted to share with you, particularly as we talked about knowledge at the beginning, is we have got loads of resources now that are there to help people understand, and hopefully there's something for everyone in this kind of mixture. We've got the website. I'm sure you're all able to find that very easily, and that will have a page on it. It's got lots of links and things you can get into. But we've got leaflets too. So the ones in the middle with the blue and the faces on, they're kind of A5 size, and they go through in a bit of detail for particular specific types of diabetes. So it's something you can take with you. You can read on the way to an appointment, or you can check through once you've had one to make sure you've covered everything you needed to. But we've got some really tiny ones as well. The ones in the corner, we call them Z cards. They're little foldable ones, size of a credit card when they're folded up, easy to stick in your pocket, easy to carry around, easy to take to an appointment. We've got a version 2 for an easy read versions for people maybe English isn't their best language or just want something really, really simple. And we've also got Learning Zone, which is a kind of education resource, like an online thing that you can go in and look and see and learn different pieces about diabetes care. That one, I think we'll make sure we pop into the chat in case you guys haven't seen. So there's matters of stuff that we have there. If I go to the next slide, Emily. One thing we know is that getting this information to people is really tricky. We're not always looking out for leaflets. We're not always excited to pick up a new thing and put it into our bag and carry it around for weeks and not look at it. So we have also created, with those little tiles that I showed you earlier, a GIF. So this is something that is shareable. You can share this on WhatsApp, on any other different kinds of social media. So I'm going to see if the team, can anyone see if they can get it into the chat while I'm still talking? It should be shareable on Teams, those kind of things, so that people can hear and know more about the checks. We really have understood too that public social media isn't for everyone right now. Like, it's all a bit, difficult, and people don't often post in places and in the way that they used to, but this is shareable on your private media like WhatsApp, places that might feel more trusted than some of that stuff that we have these days. And if I move on to the last slide, Emily, this is the kind of request we have of you as volunteers. We know, particularly in England, this is the time of year that people often get asked in for a check or to fill in some gaps if there's some bits of that process that have been missed, just because the NHS is coming towards the end of its financial year and it's kind of tidying up before they sort all the payments out. So we know it's the time that the NHS is talking to people with diabetes about this. They're probably also talking, if it's in any way helpful, to people with high blood pressure, to people who've had heart attacks and strokes and all of their checks. This is a time of year when the NHS is doing its catch-ups on things it should have been doing routinely over the year. We know, as I've just told you, we've got loads of great resources from the last 2 years worth of doing this as a focus for Diabetes Week. And we thought, let's put those two thoughts together and see if we can share this information, all the cool stuff that we have, at a time when you're more likely to be hearing it from the NHS. We're really keen to share, to join forces with lots of people. So for you guys as volunteers, we would really love you to get involved. We're also working with the NHS, with our other partners, and asking that same sort of question. I've got a lovely website, which I'm going to put in the chat as we're having our discussions. But this is a conversation we wanted to have with you today about, now hopefully you understand a little bit more about the checks. If that was new for you this time, hopefully, again, if that was new for you, you can see, wow, there's loads of really great stuff that we can share. How do we get this stuff out to people? You're the ones talking to people with diabetes all the time. You're out in places that me and the team can't be. What's the best way that we can get this to people? What are the kind of the tools that we can use? I'm gonna stop now, if that's all right, Emily. Thank you. Fabulous.
Thanks, Helen.
What is it? What am I handing back to Danny? I will stop there. Thank you.
Yeah, if you were finished, Helen, I don't want to interrupt you then. Thank you very much. Yes, so now, we've had a bit of scene setting about what it is we're talking about in the health checks. That I'm really pleased we're going to hear from 2 volunteers who are doing lots of work in this area. So first of all, I'm going to ask Mohammed, who's one of our community champions, to tell us about his activities and how he works to promote health checks in his area. Thank you.
Thank you, Danny. Am I audible? Yes? Okay, perfect. Thank you. Good evening, everyone. And thank you, Emily and Danny, for inviting me. I'm Mohammed Qureshi, and I have had the privilege of being a diabetes community champion for over 5 years now. I have been working with staff, our engaging communities officer across Slough, Windsor, and also with the London team to support communities to better understand and manage diabetes. So today we are here to focus on something simple but absolutely vital, and that is the regular diabetes health checks. We all know that these checks help spot early changes, prevent complications, and support people with diabetes to live a life to the fullest of their capacity. Yet too many people are still missing out, as rightly mentioned by Helen in her talk. So that's where our part comes into play. So in my community outreach work, I see every day how powerful these conversations can be. Just this afternoon, I delivered a session in Slough on diabetes and Ramadan, helping our Muslim community prepare to fast safely and understand why their diabetes health checks matter more than ever. Also, to promote health checks, last year what I did was I liaised with Healthier Slough to bring a mobile health clinic directly to employees at the Progress Business Center, so right across their workplace. That is one of the workplace based in Slough. And the response was fantastic, with several health checks and assessments being carried out. My background in health and social care management has allowed me to support care homes and extra care schemes across Slough, Windsor, and London. Last year, I initiated a Diabetes Ready campaign and reached over 75 elderly residents and care workers and supported them in feeling more confident and in control. And some even managed to make life-changing improvements as well. So as we head into Health Checks moment, I would like to advise all my fellow volunteers that every conversation you start, every reminder you give, and every person you encourage to book their health checks could make a life-changing difference. Therefore, we need to keep working together because the change truly starts with us. Thank you.
Thank you so much, Mohammed. That's a really lovely note to finish your speech on that. Yeah, everyone matters could be saving a life. Thank you. And next, I'm pleased we're going to be hearing from Jackie, who is based in Northern Ireland and is one of our events volunteers. Over to you, Jackie.
Hello, thank you, Danny. I currently volunteer in several areas: info stands, group talks, patient and public involvement, assisted conference open days, and a group called DAILY, which you mightn't have heard of. It's the Diabetes Lived Experience Advisory Committee. It's a group of volunteers who meet 4 times a year to give their input and help plan the strategies for DUK as we have the lived experience. And actually the one was on Saturday there, and we covered this off on Saturday as well. It's certainly getting a lot of attention at the minute. So for me as a volunteer, I think the info stands and group talks are the main areas where I can raise awareness as I'm speaking directly to the public. Unfortunately, as diabetes becomes more and more prevalent, most people you speak to are either diabetic, pre-diabetic, they have a close family or friend who are. And it just provides the perfect opportunity to chat about their journey so far and introduce the health checks. We have great leaflets to give them so they can keep an eye on what should be offered, as it's hard to recall everything. Also, some chat to emphasise why the health checks are important. And obviously you have to be careful of, we're not medics, and not to frighten the daylights out of people, but to create an awareness of their importance. And just, it was touched on in the slide, it's not about getting bad news, it's about preventing getting bad news or getting it soon and fixing it. From a personal point of view, I never had a podiatry food check until I became a volunteer and realised I was due. And I had diabetes in the family. I knew the associated risks with family members with complications, but just assumed that it was those with higher risk type 1s or injecting or whatever. Basically, I assumed that the system always worked properly. Also, I suppose I don't shy away from talking about diabetes in other areas of my life, not just when I'm volunteering. So everyone in my gardening groups, coffee mornings, etc., would know that I'm a diabetic, that I volunteer for DUK, and I advocate for an awareness of better lifestyles, prevention, diagnosis, and all that follows. So basically just talking about it helps with the stigma thing too, I think. So basically my diabetes hat doesn't come off once an event is over. From a slightly different angle, I got to hear a very interesting talk at a recent healthcare professionals conference, and it was the talk about the problem of no-shows or people not responding to the invites. So I think it just really enforces that success with health checks is not just about people knowing what they should get and understanding their importance enough to want to get them, but making easier to get it and attend. I'm lucky, I'm still independent, driving, retired, but many are not. Where I live, which is not totally remote by any stretch of the imagination, if I didn't have the ability to drive to appointments, they would get very problematic and mostly involve one of my 3 daughters taking time off, and 2 of them live in Scotland, so that wouldn't be so handy. There were great suggestions made about a roving team providing a one-stop shop for all checks. So I was really interested. I honed in when Mohammed said about the mobile unit. Densely populated areas might justify a permanent. Things like this are not easily done, but I think something of this nature would really help to improve the overall outcomes and attendance at health checks. Again, it is something that as volunteers can raise awareness of and advocate for, as there is little more compelling than someone who has been there and got the t-shirt. So I know it was touched on again. It's not a nice word, people don't want to hear it, but I think it has to be Saturdays as well, or evenings. And to finish, this is where the daily role would help a bit. Whilst it's not a direct to the public, it gives me a voice to influence, suggest, and advise what suits the actual diabetic person in all aspects of their illness. And as I say, it was widely discussed and taken up at the meeting on Saturday. So it was. So thank you.
Thank you so much, Jackie. Yeah, lovely to hear about the wide range of work you're doing through different activities. So yeah, thank you, Jackie and Mohammed, the 2 wonderful volunteers we've heard from. So what we're going to do it shortly, and I should say, actually, if you've got any questions either for Jackie or Mohammed, please put them in the chat, and hopefully we can follow up with those. If they're not able to answer this evening, we can put it in the Q&A. But some of you will be about to be in a breakout room with Jackie and Mohammed. Lucky you if you get one of those 2 to get some inspiration. So in a second, we're going to go into breakout rooms. And in each room, you'll be with a Diabetes UK facilitator who will be asking you a couple of questions. So we'll start by asking everyone to introduce themselves. We'll have 15 minutes for the breakout rooms. And then after you introduce yourselves, we'll be asking you to think what practical volunteering activities you've done to promote the health checks, and what plans you've got to further promote them as part of this campaign. Now you've seen the resources we've got that we can share with you. So we'll put those questions in the chat as a reminder, and also a reminder just of those 3 bits of housekeeping that we mentioned. So please be respectful of people's voices and opinions, make yourselves comfortable and take breaks if you need to. And if any tech issues happen when you're in the breakout rooms, don't worry at all. We will have a member of staff waiting in the kind of central room. So if you end up falling out of the Zoom and coming back, my colleague Jamal will be able to look after you. So I think we'll share the questions in the chat, and then thank you, Emily. And we will go into breakout rooms in a second. So we'll have 15 minutes, and then we'll come back. And yeah, it sounds like there's lots happening. Thanks, Jen, for restarting the recording. So yeah, we've got a few minutes now just to share any reflections. And I know Paul in my group had a really interesting example about the super checks that he was willing to share. So Paul, I guess I'll just give you a quick minute to share that.
Yeah, thanks, Annie. Thank you. So I volunteer, and I have done. I'm just about coming up for the 5th session. So we call it a super clinic. So our PCN is organised. It's usually on a Sunday. Usually runs from about 8:30 in the morning till 5 o'clock. And they will invite anything up to about 90 people to come in and have their checks. So they're obviously welcomed into reception. They normally do the in reception while they're sitting there. They'll do their little atrial fibrillation thing, and then they'll go through. They'll do their checks. They're all with a specified nurse that will run all the weight, the bloods, everything else. They've got in our part, we've got Healthy Cornwall, who'll give lifestyle sorts of things. They can help people if they're smoking, if they're perhaps drinking too much. They'll signpost them. Some of them have signposted swimming, and it's actually sea swimming down at Charlestown in Cornwall. They've also got the mental health, so there's a talking therapies. We've got a doctor who will look at prescription, the medications, if you're not quite sure of the medications. And finally, they come to the last table, which is before they go out the door, they come through to me and normally a fellow volunteer, and we make sure that they've filled in their little sheet. They've got everything filled in, that they've dropped off a urine sample, and then I give them some of the leaflets, the wonderful leaflets that we've seen advertised, and I'll advocate for Diabetes UK, saying, you know, I've used Diabetes UK, especially the recipes, and what have you, and that's it. My evangelism is done, and away they go, and I have appeared on local TV and everything else down here as well. So, because I was a winter wellness champion, there we are. I was on about wearing 2 pairs of socks to keep your feet warm. But bless it. Yeah, I was just saying, it's wonderful that we've got so many volunteers who are putting themselves out there and advocate. Jackie in Northern Ireland, I'd love to go over and visit and listen. Bless.
Thanks, Paul.
Thank you very much. Sorry.
No, not at all. That was brilliant. And we didn't arrange that in advance for you to do a plug for our recipes, but thank you. I appreciate that. So we don't have time to go do a kind of feedback from each facilitator, but I think we'll hear from one more colleague. I think we're going to hear from Esther about her group.
Yeah, thanks, Danny. Hi. Our group was had a good mixture actually of experienced and new volunteers, which was brilliant. And there was some chat about getting some volunteering in local groups, you know, getting people to the groups can be an issue. So there was some talk about having like some remote review, you know, remote meetings, and you know, having them kind of in person and having that kind of mixture for people. But there were some great examples of people going to shopping centres, particularly when they're doing it in conjunction with councils and things. So getting in touch with your local council and things, and seeing if you can be involved in those kind of health messaging and stands. And so they were talking about taking our leaflets and talking to people and things. There were some really great examples of having active group meetings and talking about care processes. So somebody had their lead GP come and talk about 9 processes, but then having individual sessions focused on each of the ones, which was really great. And there was a really great advice from a person about getting to know your network leads, because then you can contact them directly and find out what things are happening in your area and what things that you can get involved in to kind of further promote the campaigning. So yeah, lots of different things and lots of plugs for our leaflets again, which is really good. And it's nice to know that you like the folding up what care to expect leaflets. They're really easy to take out to people. So great chat in our group.
Amazing, thank you. That sounds like it was a lot of chat there. It's great. Hopefully some inspiration for volunteers who aren't sure how to get involved. We also had a range of people who've just signed up and have are seasoned volunteers, so they've heard some new ideas on what they can do on this. Thank you, everyone. So as I say, we didn't hear from all of the staff who were in each group, but what we'll do is that everyone's made notes, so we'll follow up on any actions. If there's any kind of recurring questions that came up, we'll put those in the Q&A as well, so you'll have access to that as well as the recording. And Paul, you forgot to mention that PCN also has 2 diabetes support groups on the first and last Wednesdays of the month. Great plug for that. It sounds like you're busy. Okay, so what I'm going to do just to bring the session to a close is I'm going to relaunch the poll. And Andy, thank you. So you said the one thing that came up for us is remembering that health check is equally important for people in remission. Yeah, thank you. That's a really helpful reminder. Thanks for that. So I'm going to relaunch the poll here. So this is similar to what we did at the beginning, but it has 2 questions this time. So the first question, can I get a thumbs up if that's worked for people? Yes, thank you. So the first question is the same as the one before. So thinking about the end of this session, how confident do you feel to promote our diabetes health check resources as a part of your volunteering role? So same as before, 0 is not at all confident and 10 is extremely confident. Thank you. And thanks, Bev. I can see you put a 9 in the chat. Thank you for that. And the second question is, how would you rate this evening's event out of 10? So we're saying 0 is poor and 10 is excellent. So I'll give you a few seconds on that. And thank you, Annette and Bev, putting it in the chat as well. It's good to see. So I can see the answers still coming in through now. Okay, I will end the poll. Oh, the still, I don't want to end it because I can still see them ticking up. Okay, they've stopped coming through now, so I'll end the poll and share the results. So we've got generally it seems that people's confidence in in sharing the diabetes health checks resources has increased. We had a few lower at the start, and it's got higher, so still fewer on the middle. And I would say that if you've got any questions, then please let us know. You've got our contact details, and we can hopefully answer them and give you some ideas. And lots of people towards the top. So we've got about over 50% towards the top, 8, 9, and 10. And then on how you found the event, it's ranging. So we've got lots of people, a few people in the middle, and lots of people saying that it was 8, 9, and 10, which is great. It's really great to see. So I'll just share that briefly for a second. Lovely. So I think all that's left to do, I'll stop sharing that, is to thank thank all of you for attending. Hopefully you've got something from the event, you've got some new ideas and some inspiration. To thank, of course, Mohammed and Jackie for speaking. It was brilliant to hear what they're up to around health checks. To thank Helen for speaking as well and sharing about the campaign, and all the Diabetes UK staff who are here. So yes, we will be, if you have any questions, then you've got our details. We'll be running future events as well, so keep an eye on those on Assemble. And Casey, you're very welcome. Good to see you. But yeah, thank you everyone, and we hope to see you soon.